Good morning, good afternoon, good evening, wherever you are around the world. Thank you very much for joining us. Welcome to the Euro-Mediterranean Economists Association webinar, which we're talking today about the brain economy and specifically moving from hope to action. We're going to get from the hope of the World Economic Forum and the wonderful successes that we had, significantly thanks to George Vredenberg's interventions a couple of weeks ago, and a work that we've done recently at the European Investment Bank to get very specific about what does this mean to regions? What does this mean in the context of cities or local jurisdictions? And specifically, what can we learn from living lab models and economic development models? So this webinar is, we're very grateful to Rim Ayadi for hosting us, also being co-supported by the Brain Capital Alliance, the Brain Economy Hub, and Rice University Baker Institute for Public Policy Neuropolicy Program. I'm Harris Eyre, and I'm delighted to be with you all. And we have a wonderful set of interventions today from expert colleagues and then also discussants as well. I wanted to make a few points before we get started. And I'm just going to quickly share my slides to set some context for everyone that's listening. We're here today to talk about actioning regional economic development. A tipping point was certainly passed after the successes of the World Economic Forum, as I mentioned, and also the wonderful interventions and meetings that we had I think it was last week now, it seems longer than that, at the European Investment Bank. We'll be hearing from Shiva Dastar. But the question is, what does this stuff mean to regional economic development? We think it can be very impactful in a new model, but today we're going to explore this in great detail. Of course, in economic development, we want to think about things such as, and we may want to talk about some of these things today, what are we doing for entrepreneurship, for the formation of new businesses around the brain and around actually the mental health of entrepreneurs as well? What can we do about industrial growth, industrial innovation? What can we do about local GDP, local productivity? Is there a relevant to talent attraction, retention, education, and workforce? Are there relevance today when we think about neurodiversity and improving education or the role of brain health in the workplace? The living lab model is something that is very strong in the context of Europe. We've been studying the European Network of Living Labs, and they have a report that was published last month. Living labs are very interesting models which integrate in public, private, and philanthropic and weave together new approaches to solutions for economic development. And here's a nice visualization, but we're going to unpack living labs very much throughout the course of this morning. We, of course, as everyone knows, we have a global brain capital dashboard. So are we today wanting to think about a regional brain capital dashboard in one particular region that we could start with? That could be an interesting idea to explore. And there's, of course, systems change. That's one of the things we've been very much focused on in the last month is taking global systems change strategies and localizing them to a local region, looking at in different sectors in local regions, what shifts do we need to see to build brain capital, and what are targets and indicators? And could we do this regionally? Do we have the data for it? And maybe different regions have different data opportunities and data challenges that will make this interesting global discussion. Today we have speakers from Global North and Global South to unpack this. So a tipping point has been passed. Let's get very specific on what this means for regional development. And without further ado, in the interest of time, I want to invite Rim Ayadi, the founder and president of the Euro-Mediterranean Economists Association, to make some opening remarks before we then head into our formal agenda. So thank you all for being here, and Rim, over to you for some insights.
Thank you very much, Harris. First of all, I would like to congratulate you for the great successes that we have been achieving within this Brain Capital Alliance and the Brain Economy Hub. I think this is all really bringing us into the realization that we need to do something different for our economies, particularly in terms of the challenges that we are practically seeing globally. So yes, hope to action. I think we've been really trying to imagine our economies anchored in the progresses in neuroscience, and together with George, with Shiva, Kana, and many other colleagues, Steve, that we are trying really to think this new model for our economies. And effectively, the Living Labs, it's one key element. And at the Euro-Mediterranean Economists Association, we are working a lot with Living Labs in other areas, for example, in the green economy. And it's really working very nicely. And this is really a way to develop pilots and to upscale them over time. So I think nowadays, those profound transformations that we are living in our world in terms of the climate crisis, in terms of the digital revolutions, and also the demographic shifts, and all these elements are reshaping our economies, are also reshaping our brains. I think our brains now, they have to strive in uncertainty and trying really to be much more resilient to those challenges that we are seeing every day. And I think also the future of our economy must be sought into investing in our cognitive, our brain and mental health and emotional well-being, because in fact our brains, as I mentioned, it's used into some sort of stable environment, and nowadays the environments are becoming more and more unstable. So the essence in reality of the brain economy, which is a model, I repeat, that is recognizing the brain health and brain skills as fundamental drivers for productivity, resilience, and economic flourishing, could be a model that will complete our green economy model that we would like to develop to reach this well-being economy that we would like to see, hopefully, in the future. And in fact, translating this vision into action requires much more than policies and framework, I'm afraid. It demands really tangible, real-world experimentations, spaces where innovative ideas can be tested, refined, and scaled up. And this cannot happen without experimentation, so without science, and without investment, without systemic investments to be able to take the risk, and also guaranteeing our investment, because of course the risks are becoming much higher than before. So this is why the brain economy Living Labs comes in. These labs, as I said, and you said, Harris, they serve as incubators for cutting edge policies, new financial instruments, technological solutions that enhance brain capital across multiple sectors, from healthcare, education, finance, and also urban planning. So we can imagine really different ways, different situations, like, for example, a city where urban design promotes cognitive well-being, workplaces that integrate, for example, neurodiverse talent, financial systems, and also that prioritize investments in mental resilience. We can also imagine sectors where we promote further, brain resilience, brain capabilities in, for example, also neurodiversity, and so on and so forth. So we can imagine several situations, and I think we need to focus on those. Obviously, we need to move, and I always say this, beyond GDP to human flourishing, where in reality the human being is in the center and the brain is in the center. The public sector and the private sector together, they can play a fundamental role, and also the philanthropic sector, because they have really the ability and the agility to transform a vision into an action, to pioneer high impact investment, and also all of us together working hand in hand in terms, for example, as you mentioned, the dashboard, the global dashboard that could be also regional and local, but also the system change lab, where we can test very clear, I would say, solutions in different countries based on the specificities of different countries. For example, I'll just give you an example of Spain. Here in Catalonia, we have teamed up with a mental WeMind cluster. It's a mental health cluster here in Barcelona, and we are developing specific data sets connecting, the regional and the global data that we have in the dashboard into the local dimensions. And this is also collaborating with hospitals and collaborating with other data providers. So this will allow us really to give the possibilities to use this data for clear policy action and impacts for the building of the brain economy. So I am really very much looking forward for our conversations to move beyond theory, beyond policy, to go into action, to go into real solutions on the ground, and to implement practices. We can see, for example, that in Finland, they have moved into their brain plan, also in terms in Switzerland, in many countries. And I am also discussing with several African countries to start really the thinking about brain plans. Of course, I would like to see how these brain plans could translate into policy and into action with that we are able to measure the success going forward. So thank you again, Harris, for this great opportunity. We are fully committed at the Euro-Mediterranean Economists Association to continue this transformation. And together with all of you, we hopefully will make a change and we make the action become real and become transformative for the people. Thank you very much, Harris.
Wonderful. All right. Thank you so much, Rim, for getting us started. I like that you mentioned the lessons that we can learn in the brain economy from the nature economy, from the green economy. And I know, of course, that the European Investment Bank thinks about the blue economy. So these are good analogous things to learn from. And you also evoked inputs and outputs that we should be thinking about that as a structure. So that's thank you for leading us off. Okay, now let's turn to Kana Enomoto, who's the Director of Brain Health at the McKinsey Health Institute. Kana, welcome your remarks to us early in the morning here. Thank you. And after Kana, I will in sequence introduce each speaker as per the agenda. But Kana, over to you.
Good morning. Thank you, Harris, and greetings. I think Harris, Steve, and I are all California, so it's 4 a.m. for us. And if it weren't such an energizing topic, it would probably be more difficult to participate in the webinar. But here we are, shiny faces, because the importance of brain health in shaping the future of the workplace is really tremendous. I do have slides, but I don't see them. Ah, there they are, as if by magic. There we go. So if we could go to the first slide. So I'm from the McKinsey Health Institute, which is a non-revenue generating entity within McKinsey, and we are dedicated to adding life to years and years to life and creating global public goods that can inform how people think about their health. And I lead brain health within that. And so we've been doing some research looking at IHME data and understanding what is the total burden of brain health conditions, not just the primary burden, the disability adjusted life years for mental, neurological, and substance use disorders, but also the burden that is associated with these, because we know that virtually all people with dementia live with other chronic diseases, people with mental disorders, and substance use disorders have sometimes 3x, 4x the rate of certain non-communicable diseases. And so we see here that fully 1 out of 3 disability adjusted life years related to non-communicable diseases is either directly or indirectly related to a brain health condition. So 600 million disability adjusted life years are attributable to mental, neurological, or substance use disorders. And so you see, this is as we gear up for the 2025 UNGA high-level meeting on non-communicable diseases and mental health, it's more important than ever that we take a brain health lens because of the tremendous burden that these conditions create. And this is on the disease side. And that we're not going to tackle the NCD issue if we aren't addressing these conditions. Next slide. And maybe just to, many of you are already familiar, but just to recap, when I'm referring to brain health, I'm including mental health, substance use, and other neurological conditions, including stroke, dementia, Alzheimer's, and not just the disease end of the continuum, but also preventing disease and promoting optimal brain function to enable individuals to thrive. When we're talking about brain capital, it's a form of human capital that combines brain health with brain skills, which I'll get into a little bit later. And then the brain economy is the economic paradigm that prioritizes brain capital as its core asset. So this is the emerging economic belief system that asserts that our brain health, both collectively and individually, is a meaningful driver of economic growth and economic competitiveness. And so in many ways, we're already well on our way to the brain economy, as Harris and Rim have noted. And it's very exciting to think about how living labs could provide a critical opportunity for us to both test and advance this transition. Next slide. So in the past year or less than past year, we've seen the brain economy movement gaining tremendous momentum. I think Harris had a tipping point slide. We saw conversations happening at UNGA, amazing conversations happening at Davos, where Forbes noted that brain health emerged as a top priority there at the annual meeting. February, Shiva hosted us all, many of us, at a meeting at the European Investment Bank to discuss brain health and possibilities and the need for coordinated investment there. And we're looking forward to the G7 in June, the UNGA in 25, again, as I noted about NCDs and mental health, and then again, another, hopefully a science summit focused on brain health and the brain economy. And then even further later in the year, looking at the G20. And I know many on this call are advancing efforts to make sure that there's meaningful conversation around the brain economy at each of these venues. Next slide. And so Rim also noted that the workplace has an important role to play, and employers have an important role to play. I mean, it's not surprising. We predict that a rise of global GDP by up to 12% if employers would proactively invest in employee health and well-being. And so this is across, and now that is including physical health as well as mental health, as well as cognitive performance and thriving. On the flip side, we also know that these challenges account for an estimated $1 trillion USD per year in lost productivity. And as I noted, the disability adjusted life years. So given these outcomes, the economic case for employers to invest in brain health is pretty clear as well as urgent. Next slide. And for me, when I hear trillions, my mind starts spinning. Maybe there are economists on the line, and so for you, it's very easy. But we've also seen our friends at West Health and Kennedy Forum broke this down into a more bite-sized way of thinking about this, and that they talked about BrainCo, a company with 10,000 employees, and imagining the economic tax on that company that's not investing in its brain capital. So you could see up to about $23 million just coming from untreated substance use disorders, employee burnout, untreated depression, and caregiving for older adults or loved ones. That just in those 4 issues, this 10,000 employee company could lose as much as $23 million in productivity and healthcare costs and lost time. Not to mention, the pipeline of if we aren't investing in early childhood, early education, a third to 40% of your workforce is at increased risk of lacking the essential skills that you need for the workforce of tomorrow and for the workplace of tomorrow. Next slide. So I mentioned brain skills a little bit earlier. According to the World Economic Forum's Future of Jobs report that was just released in January, brain skills, as you see on the left-hand side, dominate the list of today's critical skills. And so this is a survey of 1,000 CEOs and what do they think is most in demand for jobs today. Also, what are the top skills on the rise through 2030 in the next 5 years? Obviously, AI, network, cybersecurity, it makes sense that those are the top three, but you see, there are still half of the skills continue to be brain skills. And so this is really brain health, brain skills, the brain economy is shaping the future of work. And so this, again, another clear point of why this is so important to employers. Next slide. And here's a collaboration that McKinsey Health Institute did with Davos Alzheimer's Collaborative and Us Against Alzheimer's, which was also presented at Davos, where we looked at, I think I heard from George and Kelly and Drew that when we talk to employers about neurological health, sometimes they feel like they have too many things coming at them. They have mental health, they have workplace performance, and so many point solutions that they can't navigate or don't feel like they have responsibility even for addressing neurological health as well. But when we took a look at the literature, we looked in an AI-enabled kind of analysis of the literature, looking at what are the risk and protective factors for each of these domains. And within this, we looked at the highest prevalence conditions. And what did the research say are the risk and protective factors? And then we looked across those risk and protective factors and identify where was there overlap. And here you see on the left-hand side, the 9 common risk and resilience factors for which we've found strong evidence for a relationship to all 3, right? So stress, sleep, community engagement, those are whether positive or negative, those are risk or protective factors for conditions across all 3 of those domains. And on the right-hand side, you see what are the sources of value for employers. So neurological health is very similar, in fact, to workplace performance and mental health in that it has a contribution to whether you are able to retain or attract talent. It has a contribution to whether or not people are productive or you have presenteeism or absenteeism. We see workplace performance directly affecting increased innovation and creativity, which is a prized brain skill. And then all 3 of them contributing to reduced healthcare costs, as well as adaptability and learnability, I think is another way to put it. And so this, you can see this graphic and more about the research and the way we did this by scanning the QR code here. But I think it's just a helpful way to understand how different dimensions of brain health come together, not only in things that we can do to prevent or promote it, but also how does that play out in the workplace for employers in terms of affecting things that they value in particular. Next slide. And Rim, I was happy to hear noted the need for increased and focused investment, particularly that de-risks innovation and creates a path to progress. This is a slide that we've created for our Coalition for Mental Health Investment. So it's talking specifically about mental health funding, but I think you could apply this across the board for brain health. But we have had funding in many cases that is a little bit agnostic of the value chain. So whether we're funding innovation or funding translation scale, capability building, or wide scale implementation, people will do grants or people will do private equity, and they're not really necessarily putting the right kind of capital against the part of the value chain where the particular asset is, and they're not necessarily we're not necessarily being as thoughtful as we might be in terms of the financing approach. So there's innovative financing approaches like social impact bonds or guarantees and other avenues of financing, but there's also traditional financing, which we could be using smarter in a more tailored way and also in a more coordinated way so that we're looking at how do we make those handoffs between the philanthropist and the private investor, or the private investor and the government, which will help things scale. And then how do we invest, right, in those little interstitial places where it's not as sexy as providing services to a village in a lower middle income country, but it is necessary in order to help those services to get to the next village and the next village and the next village. So this is work that I'm excited is happening, and we look forward to continuing these conversations with some of the folks on the phone and beyond. Next slide. And so harnessing the positive brain capital, I think there's a great opportunity with the living labs. I think they can facilitate cross-sectoral collaboration. It can elicit actionable commitments, because I think without targets and commitments, we're not going to make progress. And then funding mobilization, as we just discussed, I think bringing different types of capital around the table and then getting them to think carefully about the trajectory of moving things to wide-scale implementation, I think is what's necessary to both de-risk the progress and then make things available to everyone to really see the movement at the macroeconomic level. That is it for me. Thank you.
Wonderful. Thank you so much, Kana. That's a tour de force of strategic insights from you to set us up well this morning. So thank you very much. And without further ado, that's perfect to segue from kind of your high-level strategy into Stephen Reynolds' keynote presentation intervention. Stephen, you're Director of Public Policy at the Greater Houston Partnership. We're grateful that you're here. You're actually living and breathing this kind of living lab style work all day, every day in the Greater Houston region, which is a very powerful economic region of the world and very fast growing. So thank you, Stephen, for being here, and we look forward to hearing your thoughts. Take it away.
Thank you, Harris. I appreciate it. It's good to see everyone and happy to be talking about this topic. I think first and foremost, what we want to do is frame exactly what the Greater Houston Partnership is for those who aren't familiar. So the Greater Houston Partnership represents the 12-county Greater Houston region and specifically the business community within. So we have about 950 member organizations who are involved in the work of the partnership, trying to grow. Sorry, it's early morning. Trying to grow the economic region of the Houston area, as well as what we can do for the greater good. And so I think one of the things that we're most interested in is finding that intersection between the business community and the brain economy. Specifically, 2 years ago, we started looking at the impacts of the pandemic with mental health and burnout within the healthcare sector. The National Institute of Health reckons that even prior to the pandemic, anywhere from a third to over half of folks within the healthcare sector were experiencing some form of burnout. That rate has only gone up due to and in light of the pandemic. And so we wanted to, here at the partnership, address that issue. We are home to the Texas Medical Center, the largest medical center in the world, seeing over 10 million patients annually. And so it represents a large portion of our economy. We had initial discussions within the business sector about what this means to us and what our role is. And we realized pretty soon after we started the work that we needed to actually zoom out, and it didn't affect just healthcare because of the pandemic. It was impacting every industry here in Houston. And you could draw the line out and pull on that thread and say it impacts every industry around the world. So fast forward a couple of years, we've conducted an internal assessment with our member organizations where we're hoping to receive some quantitative data in return for what types of resources and benefits they provide to their employees, trying to understand where there may be some of these pain points. Instead of getting that quantitative data that we were initially hoping for, we actually got more qualitative. And I think that speaks to the newness, the relative infancy of this conversation within the business community. A lot of folks were a little bit gun shy about involving themselves in this topic, and a lot probably didn't even know what they were or were not doing. And so instead of that quantitative data, we got qualitative results, which has then spurred on additional questions and actions, and has come to a head with our most previous board chairman identifying mental health as one of his key priorities for 2024, trying to understand what impact an individual organization or one that represents many organizations like the partnership can play in addressing productivity in people. This past January, we phased in a new chair, which is wonderful, and have commitments from the new chair to further this cause when and where appropriate. I will also say that the partnership has recently outlined a new 5-year strategic plan, which prioritizes prosperity, people, and place in the hopes of addressing and improving, sorry, I'm reading some notes, talent and economic mobility, as well as resilience. And I think that this topic, this being mental health and the brain economy, fits perfectly within this sector. It's mobile, it's addressing what's going on, it's trying to identify where there are points of opportunity for us to address and make improvements. I think the biggest challenge, and this goes back to our own internal assessment, and probably many that folks here on this forum and elsewhere have experienced, is the familiarity and comfort level between a business organization, the business community, and mental health, brain economy, et cetera. I think one of the key results that the partnership has been able to identify and achieve in these 2 years of working on this topic is familiarizing and making the business community, while still uncomfortable, less uncomfortable with this topic. We identified stigma, which is no news for anyone here in this forum, but we also identified utilization rates and transparency and communication as key points of emphasis between an employer and their employee. I think if you were to look at the total landscape, yes, governments have a role to play in defining policy, but at the end of the day, a business is the one who's going to be implementing or not implementing something. And so having them on board with any directive is critical. And so being able to identify some return on investment, some key result for that business case for the C-suite to follow suit and make proactively or in following government policy the way of the future. I think one of the key things that we're experiencing is secondary hesitation, I would say. So we've done this initial assessment, and it's always, quote, where do we go from here? Or what's the next role for the partnership? Or why is the business community staying involved in this? I think that speaks to, again, the novelty of this issue for the business community. And it could be a regional issue, it could be a national issue, it could be a global issue. I think it's a combination of all three. I think dialing in some global initiative down to the most regional aspect has tremendous opportunity to scale down, to better understand what's really being done, what's really being felt, what's really necessary for making improvements within the direct human to business interaction and interface. So moving forward, where do we go from here? We're going to remain competitive. We're going to remain committed to this type of initiative, shifting it towards that economic lens, trying to find that specific economic return on investment for Houston, for Texas, for the United States, for the world. And you can scale this out and start to recognize the impact that it has. I really appreciate the expertise, the insights of everyone here. A little bit briefer, perhaps, in terms of context. I think that speaks to, again, the newness within the business community towards this topic, but happy to have this conversation.
Wonderful. Thanks so much, Stephen. It's great to hear from you because you're actually doing this. The success, we all know, will be successful today and in the coming months if we give you things to action with your business members. So I appreciate you sharing your reflections on mental health, and then also you're really giving us a call to action about how to make this make sense to business leaders. So we will heed that call to action and integrate that into our discussion and such today. And also recognizing that you're unique at the Greater Houston through the energy transition, and you have established an energy transition initiative that, of course, is very relevant to the transition of the brain economy. And my screen has frozen. I don't know if anyone can hear me. I hope you can hear me. It's back again. So let's quickly now move to Shiva Dastar, who is going to bring a completely different but complementary perspective. Shiva is the Dean of the European Investment Bank Institute. Thank you, Shiva, for hosting us last week in Luxembourg. It was a brilliant strategic discussion. And now it's nice this week we're getting more actionable and granular. So Shiva, looking forward to your thoughts. Lead us off now. Thank you.
Thank you very much, Harris and Rim, for inviting me. Indeed, I feel very privileged. It's now 1:30 p.m. But it is siesta time in Europe, so I can maybe empathize with those of you in more difficult time zones. Now, I started my UN Science Summit presentation in September with 2 questions. And they were, how much is your brain worth to you? And how much are you willing to invest in your brain? And those questions are still keeping me and my brain working, because the last few years, and really thanks to Harris, Kana, Rim, and many others actually on this call, I have become so much more aware of not only how little we know of the brain, how few cures there are around, how gigantic the challenge is, but actually how little actually we are investing in this. And I think coming in from an investor perspective, this is actually quite it's actually quite amazing that this is where we are. I mean, it just doesn't make any sense. And therefore, what I would like to share with you is sort of some reflections also from the vantage point of the European Investment Bank. So for those of you who don't know us, we are the Bank of the European Union. We are actually the largest multilateral development bank, and in that sense, actually have and do invest very heavily in the health economy, in the health sector, by the tune of 22 billion the last 5 years, 22 billion euros the last 5 years in Europe, but also outside of the European Union. And those investments are both on the infrastructure side, in hospitals, in care institutions, but also on the research and development side, to governments, to companies, to biotechs, and therefore sort of across the whole value chain. Now, I'm representing the institute within the EIB group. And actually for this particular group, I would say that the institute is the heart of the bank, but it's also the brain of the bank. So this is perhaps one way, at least we are part of the brain of the bank, and in the sense that we have within the institute's activities the foresight, looking to future-proof our own investment agenda. And as part of that foresight, because indeed of this awareness that was raised with me, we put brain economy as one of our key thematics. And indeed, as Harris was saying, it was just 2 weeks ago that we all gathered in Luxembourg. Some of us gathered in Luxembourg. It was a first of a kind, certainly for the EIB group, to bring such an eminent group of experts, policymakers from across across the Atlantic for us. I mean, from the US, Europe, Canada, around the table, and really helping us to understand also the investment imperative, what needs to be done, where are the challenges, and learning from each other, given that we had both strategic investors in the room, the pharma companies, we had public investors, we had the European Commission, and also, major associations like the European Brain, across the whole brain associations, I should say. I don't want to name any particular one, but just to say that we really did have quite an interesting group around the table to help put some light to this. And in particular, what was very important, I guess, for the EIB Institute perspective, given that we're trying to use this foresight to future-proof our own activities, it really raised awareness of how much we also, as the Bank of the European Union, need to invest in terms of understanding, but also mobilize our investments to those areas. Now, I'd like to sort of share 3 key kind of points for consideration for this group under the banner of systemic investing, or what it is that we would put as a systemic investing lens to us. One is, in order to finance innovation, there are, from many times we do need to innovate also finance. And here maybe a few examples that certainly have happened within the European Investment Bank, and I'm sure also in many other places, but I'd like to share them because they can kind of also inspire us how we could indeed continue to innovate also the financial instruments of financing in order to actually meet the challenge. One is, you may have heard of green bonds. These have been, in fact, the EIB was, together with the World Bank, we still fight over each other who actually was the first one to issue green bonds. I think we both institutions issued them in 2007. These are bonds, they are called sort of use of proceed linked bonds, meaning that when the EIB goes out in the capital markets and with its AAA rating issues those bonds that then investors from all over the world buy, they are buying, when they buy green bonds, they are basically making sure, or expecting that the EIB then invests those proceeds into projects that meet certain criteria, the green criteria. There's a whole taxonomy around it, what would constitute a green project. Now, the EIB actually celebrated its 100th billion sort of issuance towards the end of last year, meaning so we have really been using these type of instruments to mobilize a lot of institutional capital, central bank, funds, funds that would like to go into safe investments, but also into green investments. We have used, therefore, the green bonds to channel that capital into that. And this is a sort of instrument that one can, of course, imagine in the future could be also interesting for the brain economy. Another financial innovation was one that I was personally very actively engaged in and driving at the EIB was the infectious diseases finance facility. This was actually a way to say, how do we actually increase the bank's risk appetite to go into investing into vaccines of infectious diseases? At that time, we're talking sort of in the 2013-15 era, so pre-COVID, where we were looking particularly at diseases like tuberculosis, malaria, and so on, but also even the flu vaccines, and looking at how can we actually make sure we have more preventive measures, how are we better equipped. Now, we then teamed up with the European Commission, who had put grants into such projects, and we realized that a grant, once it's out, you never see it again. If we could actually have some of those grants come and give the EIB effectively a risk-sharing protection, pretty much take quite a lot of the financial risk away and allow us to go into projects, nevertheless with the mindset of having sort of like a repayable grant or forgivable loan type approach. So therefore, if the project is successful, then we would be repaid. And this would allow for a higher turnover and a higher multiplier effect of those grants. So the infectious disease finance facility, when it was set up in 2015, of course, was looking at, as I said, diseases that we sort of at that time thought were very important. And only in 2020, we were, of course, very fortunate to have such a facility in place and use it then to put quite large amounts of investments into even COVID vaccines, such as the one with BioNTech. This was therefore, in that sense, a very innovative way of sharing the risk between the European Commission, the EIB, to allow us to go into projects that actually would not be bankable. The third type of innovation I would just like to highlight here has been the way we have collaborated with foundations like Wellcome Trust, the Gates Foundation, and co-funded initiatives, particularly in developing countries, to improve access to healthcare and to strengthen the healthcare systems, not individually, not going into the same instrument per se, or not, but actually together supporting the ecosystem. And those are the sort of initiatives that I could also see in the brain economy becoming very relevant. So that's point one on the financial innovation. Point two I would like to raise is, and this is really coming from a banker's or investor's perspective, what we need, and that came also out very clearly in this roundtable that we had at the EIB. We need a greater understanding of where the investment gaps currently are. So we now understand that there's too little investment going in, but where precisely, I mean, where are the projects on the infrastructure side? Where are the projects on the research and development continuum? Having a much greater understanding, therefore, of those investment gaps and the challenges to access the financing, so that we can actually develop a pipeline of projects, of investments, and use that pipeline to understand whether we need also financial innovation, new financing in new products like the ones that I mentioned, or whether our existing instruments could actually be used as well. At this stage, and this is one of the feedback still my colleagues are giving me, who have now also gotten quite excited about the brain economy. So Shiva, where are the projects? Show me the projects. So we do need these projects. And I hope that certainly as we carry on with the conversation, we identify those projects so that we can actually bring them forth to the financial community. And then the third point, this is sort of a slogan that I have used in my various roles within the EIB on the innovation financing, which is we need more science in finance and more finance in science. We need to bring those communities closer together. This has been really a leitmotif that we have used to really go deeper into the technological risk, go earlier into projects. But when I take that sort of slogan and put it into the brain economy, what it also may suggest, and it's nice to see Steve also Carnaval, and sorry to put I see him on my screen too. Steve and I and many others had a conversation back in London actually last summer. We need to have a much greater understanding. We need to raise that conversation at the level of the wider financial community, and here I would also take it to the pension funds, to the insurance companies, who are, and certainly at the head of these companies, you have asset and liabilities. So your assets are the funds that you are investing in all sorts of portfolios, in all sorts of assets, financial assets. And then you have obviously the liabilities, all the payouts, and either as for pension payouts or on the insurance side. What we realize is we have a real allocation problem, in the sense that there must be a way to create a more integrated approach and have a much better understanding of how actually how those assets could perhaps come into the wider brain economy projects, so that you actually reduce your payouts, given all the disease burden that we are increasingly becoming aware of through the data that McKinsey Health Institute and others are showing. So what it therefore also requires is identifying the financial metrics, creating that investment narrative, investment case, so that we actually bring those two communities, the financial and the life science community, or the brain economy community, closer together, so that they actually can develop a language where indeed there is both that scientific and the science understanding and the financial understanding in place. And I would therefore leave it at this, that certainly at the EIB, we're honored to be part of this conversation. We hope to very much be also part of developing that narrative with you, and together see how we can indeed identify how we can better innovate on the financing side, identify the pipeline of projects, and indeed bring those two communities, the scientific and the financial community, and indeed the policy community and all these other communities around the table together. Thank you very much.
Brilliant. Shiva, that was a remarkable intervention from, your bank is very unique in the world, the biggest multilateral development bank in the world, and your position within that bank is unique as a head of the think tank. So just, it's incredible to have you here at the table, guiding us through and giving us recommendations on how to do this better from the perspective of banking and finance. And you've laid out very clearly some examples that we can learn from, but then another call to action for us. So very grateful for you. And And it's great that you're multilateral. So even though you're based in Europe, you're doing things globally. And so every speaker here and every discussant could potentially imagine how they could play into to the sort of scaffold that you've offered to us. And now let's go. We went from the Greater Houston region to Luxembourg, and now we go back to the Greater Houston region and to talk about brain science. Giulio Tagliatella runs the UTMB Moody Brain Health Institute, and he's a vice president for brain health at UTMB. Giulio, originally from Italy, of course, but now in Texas. So maybe Giulio can illuminate some of these American-European linkages. But Giulio, thank you for being here. You represent brain science, which is important. Shiva just made a call to action that, you know, science needs finance and finance needs science. So it's perfect segue to you, Giulio, to give us your thoughts. Thank you.
Thank you, Harris, and I'm glad to be here, regardless of the very early morning hours. You know, in Italy, we say if the good Lord wanted us to see dawn, he would have scheduled around noon. So obviously, it's unnatural to be up at this hour. Anyway, well, I'm risking seriously to sound like a voice out of the choir here. As you mentioned, I'm a basic neuroscientist. However, the way we see what we study and discover is actually wedged very well in many of the concepts that I've been hearing so far. And that also justify the role of UTMB within the broader and the larger context of brain economy and the very vibrant collaboration, of course, that we have with Rice University, the Becker Institute, and Harris in particular. So part of our philosophy, the research philosophy at the Moody Brain Health Institute is actually to address resilience of the brain and address that particular resilience at a more molecular level. I'm not going to bother you with the details, but the overall idea started from observations that we've done good over 10 years ago, and where we and other labs, other groups realized that anywhere 20 to 30% of the aging population actually present with brain pathology that would be consistent with late-stage Alzheimer's disease. However, they never become demented. So, you know, when you see something abnormal like this, either you discard these individuals or, you know, freak on nature or whatever, and that is the route we decide to take, you realize that these individuals are in fact resistant to dementia that normally accompanies this particular and dramatic disease. And now that introduces an interesting concept. It placed the brain centrally within the disease, not limited to Alzheimer. We have evidence that the same concept can be extended to other mental conditions and neurodegenerative conditions. So poses the brain centrally, not as the target of pathology, but rather as the organ that is capable of coping, adapting, and react to a challenge. And introduce the new concept that, in fact, the disease is the clinical manifestation of several diseases so much affecting our society are, in fact, the failure of the brain to provide a positive response. And we believe that part of this failure is really driven by the many, many, many risk factors that have been accompanied to these diseases, in particular Alzheimer's disease. So we heard already, we have stress, we have a lack of physical activity, we have depression, and so on and so forth. All of these collectively constitute risk factor, not just for the pathology, and keep speaking of Alzheimer's disease in this case, which is my specialty. So I hope if I'm a little bit skewed toward that, but also affecting this fundamental ability of the brain to adapt. And many of these factors are in fact driven within our everyday life, our work environment, and therefore are actually generated by the way we structure our society. So we don't walk that much. Well, living in Texas, and specifically in the greater Houston area, we live on a car, basically. And examples can be made at different levels. And that is when our interest in brain economy becomes really, really centrally, because we believe that banking on a brain economy, creating a work environment that better serve the ability, our brain power, would in fact impact in a very significant way a number of disorders that are, in our opinion, associated with lack of the brain to provide positive responses. So we take a little bit of an out-of-the-box approach. We don't ask what is bad for you in Alzheimer's disease, the pathology, and so on and so forth, but we rather ask what could be good for you if you are plagued by the pathology, leading eventually to the clinical manifestation of Alzheimer's disease. This is a foundational question. It's a switching, it's flipping the coin on the other side and shifting our attention, whence our collaboration with Rice University and the Baker Institute, shift our attention on the risk factors as a societal issue that can be generated, the risk factor, on the structure of our economy, on the structure of what we want to do, and in the workplace. This is very important and foundational for us. So imagine, we had over 40 years of research that have clearly shown that tackling with pharmaceutical and other type of approaches, the pathology itself for many different brain diseases, and particularly Alzheimer's disease, has led to very disappointing results with minimal impact on removing that particular pathology. Therefore, we need to look beyond the pathology, and we need to learn from individuals that have successfully resisted and become resilient to the cognitive decline that normally accompany these diseases. So that's where we put our research and the research of the Moody Brain Health Institute into a new dimension, and I'm extremely pleased to be sharing ideas with this group and learning from this group, because that's exactly where we believe even the basic research has to find a place. The basic research needs to become harmonious with more economical input, economical maneuver, and actually the reshaping of the society in a way to promote brain health. And we believe that promoting brain health is in fact promoting the innate ability of the brain to be able to adapt at a molecular system and global level to the challenges that can be posed by several types of pathology. So with that in mind, the goal of the Institute is really to become a foundational framework upon which important economic and political decisions can be taken. Harris? Harris, you're frozen.
Yes, I'm having some bandwidth issues, but Giulio, I heard everything you said except for the last 15 seconds. So thank you very much, Giulio, for, I think, very effectively explaining the importance of basic neuroscience in the context of the brain economy, and basic neuroscience and brain health in the context of the brain economy as well. And great that you're here representing the Greater Houston region, and we just heard from the local Chamber of Commerce in the Greater Houston region as well. So it's a perfect juxtaposition there. And so, Giulio, you're really leading the world in this thinking that you've just offered us about how to put the science behind the brain economy, and then of course how we do this locally is the function of this session today. So thank you very much. Thanks to you for being with us in Davos as well, and being on the journey.
I wanna mention actually that we were the only state institution present at the Brain House, and to really signify our commitment to really enter this type of consideration as an important part of what we do.
Yeah,
Julio,
wonderful.
Julio,
And
Texas is not a state. Texas is a nation.
It is. That's what I learned when I moved over here, and I had to become Texan. In fact, many people say I'm the only Texan with a very heavy accent, but it is a nation, and actually, Texas offered a unique opportunity to test global the intervention. As you know, Houston is the most diverse city in the United States, and that offered a huge advantage.
Well, Julio, you have given this is George Vredenberg, and I'm out of order. I will only make this very quick comment. But Shiva is looking for an investment thesis that has returns to it. And you've, I think, just given her a potential investment thesis. How do we invest in those technologies that will build the capacity of the brain to resist disease or to enhance its own performance? It's not a way of looking at brain disorders as a set of silos. Alzheimer's, Parkinson's, mental health, or the like. But how do we find transformative approaches to building the capacity of the brain to resist these diseases? So you've, at least Shiva's, I listened to Shiva and I listened to you, and I said, well, here's a conversation that should continue to occur.
I agree very much, George.
And maybe, George, you could mention just briefly what we're working on in Houston in May as potentially the near-term convening mechanism where we can further extend these conversations. And maybe we can talk to Kelly afterwards about refining some of the agenda around what we learned today. But George, do you want to mention a bit of what you're thinking in Houston?
Well, I haven't introduced myself, but I'm with the Davos Alzheimer's Collaborative, but I also have a U.S. foundation called Us Against Alzheimer's. It has a business collaborative for brain health, and it is precisely along the lines that Stephen outlined, which is the natural interest of businesses in the brain health of their employees, however expressed: lack of turnover, more productivity, greater social skills at work, how to develop those. They don't look at it as a brain health issue. They think of it in other ways, to Stephen's point about qualitative versus quantitative. And so in Houston in May, we intend to convene with the Greater Houston Partnership, with Rice, with the University of Texas Medical Branch, an effort to really think through what this might mean, given the fact that Texas does have the largest health system. Texas does have a very, very resilient and increasingly vigorous brain neuromodulation world of investment, so that we can find assets in Texas and specifically in Houston, which can begin to outline an investment thesis, a reason that businesses, how can they think about these issues in a slightly different way, more systematically, albeit they will do it their own way. And we have found that Shell has done it one way, the Georgia Power Company another way. They all look at the issue, JP Morgan a third way. They all looking at this issue in different ways and characterizing it differently, but they all are working in the general concept of brain health. And we hope in Houston to bring a lot of those forces together to develop this thesis further.
Wonderful, wonderful. Thank you, George. It's good to put that on people's agenda now in the space of this webinar. Well, thanks, George. Let's from one big economy of Texas, let's move to the big economy, which is India. So the most populous democracy in the world, with 1.6 billion or so people. Dr. Rajinder Damija, thank you very much for being here. You're the chair of the Indian government's Brain Health Task Force. We're very keen to hear your thoughts about what you're thinking with the task force, where you are and where you're going, and how we can be useful here in thinking through the living lab methodology or regional economic development. So Dr. Rajinder, over to you.
Thank you, Harris, and good afternoon, good evening, and good morning to all of you. It's really a pleasure to see all of you. Some of you I have met actually in September in New York, and others I have been hearing names from Harris for quite a long time. So it's a privilege and honor to be here and sharing my own the task force. Let me see if I can share my slides. My slides are visible, is it?
It's coming up right now, yeah. Now we can see it.
Oh, thank you. So I'll just take this out. All right. So India being the most populous country, as Harris just told, 1.5 billion actually, and the fifth largest economy in the world after in next 5 years to 10 years, we are aspiring to be the third largest economy after US and China. So it's a huge numbers, and neurological disorders have now become a major public health concern with increasing prevalence due to escalating longevity, the increasing life expectancy, and of course the new lifestyle diseases coming up and having a huge burden on the public health systems. So that's very, very important, and why we have the National Task Force on Brain Health, which is initiated by the Government of India, Ministry of Health and Family Welfare, and the Planning Commission of India, which is chaired by the Prime Minister of India. So we're talking about the brain health in context of the population. It's really vital to reduce the large and growing healthcare burden, as I said, with the 1.5 billion people, and it goes beyond the absence of disease or treatment of disorders or rehabilitation, but also increases the capacity, the preventive measures to decrease the incidence of all the diseases of central nervous system, so that we are able to function optimally and cope with the life situations. So these are the numbers from the WHO that 1 in 3 people affected by neurological conditions, they are the leading cause of illness and disability worldwide, including India. And the more important thing is that 70% of these neurological burden fall on low and middle income countries. So 1 in 3 of us will develop brain disorder at some point of our life, and this is something which is concerning. And of course, despite growing threats to brain health, there is a very limited policy response so far in most of the countries, including India, and there's a little awareness. That is why we have come up with a national policy so that we can have brain health. So talking about the various neurological disorders in India as compared to the other nations, the stroke ranks number 1, migraine number 2, and you can see dementia, meningitis, infection still having, and this is something very, very important, that 44% of our population have some or the other neurological disorders. It's huge numbers, about 570 million people having. So this is something.
I'm sorry to interrupt, but your slides are not advancing.
Oh,
I see that. So somebody ought to be advancing his slides as he's moved through his presentation.
Can you see the slides now or no?
I can see the slides. It's why is brain health important, but they aren't.
Okay, that was the first slide then. Probably yep. I will switch over to the other one. Just give me one. I'll change the.
Demetria, we can't hear you. We've lost. Can
you see that?
Not a problem. Maybe
Harris, he's trying to change his slides, so then we can see the slides at the same time.
Hello, Rim, can you hear me? Sorry, I'm having bandwidth issues.
Yes.
Okay.
Raj is trying to.
I'll just go. I'll just speak without the slides. That is fine. Is it okay? Because I don't think I can move the slides from this computer. Either I'll have to change the computer now, but that's fine. I think I was just talking about the huge burden of neurological disorders in the country with a very large number of aging population. At the moment, we have around 10% of the people having more than 60 years of age, but this number is going to double in next 15 years, that means we will have around 300 million people in India living more than 65 years of age. So that is a huge number and glaring at us, and we don't have that public health system geared to face that challenge of growing population. And mind you, these numbers, these people will not be living as a normal, healthy life, but also having lifestyle diseases with more incidence of diabetes, hypertension, Parkinson's disease, and of course, dementia is glaring at us. At the moment, the economics of dementia is huge, about 150 billion rupees being spent on the care of dementia. And if you add to the loss of productivity and the caregivers' expenses, these are huge numbers which we have little system in the public health system as of now. Again, the key points about the economic burden is that there is a very high prevalence. Apart from that, there is a rising cost of care. There are about 3,000 neurologists in the country of 1.5 billion, and there are huge out-of-pocket expenses incurred on the treatment of brain health diseases. So obviously, looking after the patients with dementia, Parkinson's, strokes, and head injuries and spinal cord injuries means a lot of economic out-of-pocket burden. And about 55 million of people are going below the poverty line every year because of the out-of-pocket expenses only incurred on the neurological disorders. Again, the incidence and prevalence of stroke is decreasing in the Western countries, but it has doubled in last 10 years in India, and that is something like something very, very glaring at us, because we have a peculiar system of having a community-based rehabilitation or family-based rehabilitation with little investment of neuro-rehabilitation or neuropalliative care. So all these stroke patients, once they get the acute treatment, are sent back to families where they have to look after their patients living with disabilities for life. So that is something very important. Again, epilepsy, there are about 12 million people living with epilepsy in the country. So you can imagine these people, particularly women with epilepsy, women having issues with marriage, pregnancy, driving. All these issues are having a very social stigma. Having epilepsy, not able to get employment, having a disability, huge numbers are there. The other one, of course, we have a state-wise distribution of neurological disorders. India being a very big state with a very big nation with 35 states, and each state is a nation itself, very heterogeneous population, very heterogeneous culture, very heterogeneous economic conditions, and very heterogeneous productivity in terms of agriculture, in terms of farming, in terms of industrialization. So each state has different problems and different solutions for that. In view of this, the treatment gap in epilepsy is 70%, treatment gap for mental disorders is 80%. That means out of 100 patients with mental disorders, only 20 people are getting access to treatment, and which is something which is a major concern for the Ministry of Health and Family Welfare. In April 2024, the ministry had come up with the national task force under my chair, and there are 20 stakeholders from different ministries, whether Ministry of Health and Family Welfare, Planning Commission, Ministry of Social Justice and Empowerment, the Indian Council of Medical Research, the major neurological institutes in the country, and other stakeholders, including Indian Academy of Neurology, and the other association professional bodies. They're all part of this, and we have been struggling to come up with a national policy and a national program for brain health. At the moment, there are national programs for different diseases, but there is no dedicated program on brain health. The stroke comes in national program for NCD. The dementia comes under national program of aging. The epilepsy comes under national program on mental health. So we are all in silos, but there is no dedicated program on brain health or neurological disorders. And that is one of the mandate of this task force, to come up a plan for the government to introduce a national plan or a national program for brain health, which can include all the brain health, including mental health conditions, and there could be possibility of having a nationwide national program. So the main focus of this program will be a district-based hospital, which is already existing, but we will have a district-based health clinics at the level of district hospitals with the linkages back and forth, up and down. the primary healthcare providers will be sending the patients to these district brain health clinics, and then the district brain health clinics will provide acute care rehabilitation, and then if required, will refer the patients to the higher centers for mechanical thrombectomies and more advanced procedures for DBS and other things. So that is a major plan coming up in India for having a district brain health clinics across the 750 districts with funding from the federal government, and that plan will be rolled out very soon. In terms of brain economics, of course, there's a huge IT sector in India. There's a huge potential for creating jobs. There's a huge potential for neuro architecture, neurodiversity. There's a lot of people who are working in these fields so that we can come up. There are about 300 startups which have come up in the field of mental health only. And of course, they're all adding up to the economy. And that is one where we have brain economy, that means brain skills and the brain health and the economists of the country are working at this. How can we integrate brain economy into the brain health program, and we can convince our policymakers to invest in brain health, and that is something which is coming. I'm excited to have to chair this task force, and this task force will come up with its final report in a couple of months time now, and that will be rolled out at the national level after that. With that, I'll stop here.
Yeah, thank you very much, Dr. Dameja, for that overview. It's a very impressive program that you're running for the Indian government. And I think you're bringing into sharp focus for us the role of healthcare, hospital systems, medical practitioners, health practitioners, which is a great complement to the prior conversations that we've had just this morning around basic science, banking, and then the role of the private sector. So, and of course, your platform allows you to bring in these other players as well. And so thank you for being here, and thank you for your engagement and for educating us as well. And I think you're obviously a model for many other countries around the world. And we particularly look forward to working with you in the context of the G20 later in the year in South Africa, where India is, of course, a big player, and then the World Economic Forum next year as well. That is the last keynote intervention of today. Now we're moving to the discussion component. So we have another great group of discussants to bring in to enrich things further. The discussants, as I call on you one by one, and encourage you to give us a good sort of synthesis and distillation of what you think all of this means from what you've heard so far to your context, and any advice that you have for us around data, strategies, quantitative, qualitative. How do we engage different types of actors in this game of brain economy living labs? And so I'll first turn the microphone to Steve Carnevale, who is here. He is a one-man band of a public-private philanthropic partnership. And so, Steve, I don't know which hat you're wearing this morning, maybe the California Mental Health Commissioner, but over to you, Steve. What are your reflections?
Thanks, Harris. It's nice to see so many friends here. I have a business partner that calls me the balloon man because I have so many balloons. What does come to mind is that after working on this problem in various angles for 20 years, I think the only answer is public-private philanthropic research partnerships coming together to solve them. There's no one constituency alone that can solve these problems. And at the highest level, I think the real problem we've got two problems at the highest level. One is that we do not yet have any precision medicine in behavioral health, because we actually don't know that much about the brain. Actually, we know quite a bit, but we aren't applying it yet in a practical way. And I think there are a lot of opportunities for that, but that's not happening. And when you don't have it with precision, people don't believe it. And when they don't believe it, they don't invest in it, which leads to the second point. And I'm really excited about Shiva's work around the bond ideas, because I've come to believe that innovative finance is the answer. I sit on the California Mental Health Commission, and what I see at every single meeting is every constituency has great needs and they're all fighting each other over the same pot of money. And so we get in these arguments between, the urgency of research, but the people who have understandably very urgent problems today with a family member or a friend don't want the money to be invested in the research to solve the problem for their children or grandchildren. They want to solve the problem today. And so there's issues all across the system. And I think the combination of getting closer to precision medicine and to innovative finance is the answer here. And so I'm trying to action that in a number of ways in California. And I'm just saying about where I want to weigh in. At the California level, we've got the Mental Health Commission that I'm part of and working with the governor on that. I'll just say that we're trying to move towards some kind of innovative finance center and I'm hoping we'll be able to create it and work in partnership with the European Investment Bank, with the World Economic Forum, with a lot of people on this call so we can figure out what some of these answers are. And I think the bond funds are really the answer, because if you can, right now, a lot of these opportunities that are being invested in the private sector are driven by venture capital, and that's great to elevate those few ideas that have extraordinary return potential. But if you can reduce the return levels down to, bond levels, 5%, you radically open the pipeline of possibilities, and the returns for that medically and ultimately economically are enormous. And so I think that's kind of the key to the whole thing. Working in California, Harris and I are now working with neuroscience, the Congressional Neuroscience Caucus. Turns out that the two co-chairs, one of them works with the Texas group, Latrell Morgan, and the other co-chair that just got assigned happens to be my representative here in Napa, California. So I'm working with his office now and trying to figure out how the Congressional Neuroscience Caucus can lean into this in a much more positive way. I think one of the ways with, I'll call it our new politics that we're exploring is that I assume most of you know what DARPA is. DARPA has a big research program in vet suicide, which is a massive problem. 22 vets a day commit suicide. And so that becomes a potential tip of the spear here. If we're focused on that, then we can use that as the reason to go after all the underlying root causes that lead to all of these mental health problems in the system. So we're exploring that as a potential approach and working with the program manager there, Greg Whitcop, who's a doctor and a neuroscientist himself. So he's very aligned with what we're doing here. On the complete other side of it, I'm focused on, and we are going to be sponsors of the Houston event. The we in this case is my venture capital firm that's been investing a lot recently in the flourishing side of the brain. And I think there's a lot going on in the disease side, but on the flourishing side, there is not. And in that area, without going into a lot of detail, is a lot of opportunity to stand up objective measurements of the brain, which get away from our current system of self-reporting, which is very inaccurate and very slow. And adding to that at scale with AI and machine learning, we're looking at some radical new alternatives which can be applied in education and in workforce development. And that in combination with a skills-based system of workforce, again, radically changes how we think about how work happens, and it allows us to bring brain capital into the workplace in a very productive and a very economically positive way. So again, without going into a lot of detail, because I don't have a presentation here, I'll just stop there and say that there's a lot of opportunity on all sides of this equation. Thank you.
Brilliant. Thanks so much, Steve, for adding in those extra layers and the context of California, which is important as we talk about big places with big economies. That's another place that's very important. So appreciate you putting California on the map, and then these other different areas from learning disorders to workplace brain skills to mental health. And so then next discussant that would like to move to is Paola Zaratin, who's coming to us from Italy today, I believe. Paola, you're the Director of Scientific Research at the Italian Multiple Sclerosis Foundation. And you were with us in Luxembourg a couple of weeks ago with Shiva. So thank you for being on this journey, and we'd welcome your reflections on what you've heard so far today.
Thank you very much, Harris, and to give me the opportunity to share my thoughts and also building on Luxembourg events. And of course, here I'm bringing the perspective of patient organizations, and I would say brain disorder patient organizations. And for such a kind of organization, brain health is not an initiative indeed, but is a fundamental business priority. And we are lucky from this point of view, because as a stakeholder of, the, I would say, patient capital aspects, for us, it's easier to put this at the center of our business, and perhaps a stakeholder and to build a financial case. This could be, I would say, an opportunity to bring on board, someone that has indeed this as business priorities. So in terms of financial cases, I do believe that still we need a global mission on brain health and brain economy. Means that living labs and living organization, living labs organization are, very good, important. But I would say that it would be important also that this case studies, regional case studies, could meet or could contribute to overall global mission. And the reason why I'm saying this is because I do believe that mission-driven approach could, put us around the same mission, the same objectives, and each of us can take responsibility for this. And for this reason, in the interest of patient, we are representative, indeed, working in line with responsible research and innovation principle. We have indeed the developed model where patient engagement and patient inclusion is not a standalone strategy, but is also empowered by a governance, participatory governance criteria. Means also multidimensional impact factor that can help stakeholders to see that investing in patient capital and investing on patients and brain health would represent return of investment also for the other stakeholders. So this was the way how we approach brain health, and we approach also financial case studies. And out of this, of course, I agree that we should find some financial cases that are more relevant than the other. And for us, I would say the data-driven future towards brain health is one of the key central aspects. Barcoding brain health, and then coming back to the consideration also Giulio Tagliatella, barcoding brain health means finding what are the brain health drivers and factors, and investing on this really would represent important financial case studies. Also because in this case, of course, patient reported aspect is going to be key, or citizen reported aspect is going to be are going to be key, because we need to unmask early phase of disease or neurodegenerative progression. And I believe that the data reported, patient reported aspect are very important to achieve this goal. So barcoding brain health is going to be a very important financial case moving forward, in my opinion.
Wonderful. And Paola, I wonder if you could also extend your
Sure.
Reflections on the role of arts and culture, and some of your observations with the Prada Foundation.
Absolutely.
They do a kind of living lab model, if you will, in Milan
Absolutely.
and in Venice. And so just bring us a little bit into some of your observations there. I think, arts and culture seems very important as we want to change hearts and minds.
Absolutely. And Prada Foundation is a very good example on how to bridge science with the citizen and science with patients. And this is a project launched by Professor Giancarlo Comi under the umbrella of Human Brain, and now is evolving into an initiative named Preserving the Brain, a Call to Action. And it's very interesting example on how, cultural institutions such as Fondazione Prada is ready to invest in citizen capital, is ready to invest in brain health capital. So they have been promoting several initiatives, such as meeting fully focused on preserving the brain and brain health, but also initiative with brain disorders patient organization to indeed share the idea, share the concept that investing in patient capital is not the only business of patient organization or a specific stakeholder, but because of brain economy, because of brain health, is indeed a co-responsibility of all the citizens. And so it's going on, this initiative. So, and I'm sure that they would like to be exposed or to be engaged in such a kind of discussion moving forward. I'm contributing to this initiative, especially in terms of communication and making sure that we are speaking the same languages, because this is important, let's say, financial cases, because if we are not speaking the same languages, it will be very difficult to bring citizens on board. So I had the opportunity to contribute to several initiatives on this, focus on these aspects.
Wonderful. Thank you so much, Paola, for painting that picture for us as well. Appreciate you bringing the importance of patient centricity and patient empowerment into this debate, which is critical, as a lot of this is about brain disorder prevention, brain disorder management. So thank you, and it maps very well to Julio's world at UTMB and to George's world, and of course to Dr. Dimitri's world. Anyway, it's very relevant, and then relevant to the role of philanthropy in arts and culture is a perfect segue to Penny Dakin, our friend and colleague who's dialing in, I think, from Perth, Australia. But Penny is Executive Director of Communities at the Minderoo Foundation. Minderoo is a preeminent global philanthropy based out of Perth, Australia. And so Penny, very keen to hear your thoughts and reflections as you've been listening into all of this, and how do you see all this work today?
Yeah, thanks very much, Harris. I think I have somewhat of a unique perspective on this, I think, given the audience and given the work that Minderoo does. We ground our philanthropy, and certainly the stream that I lead in communities, in the early years and early childhood development, and the power of early childhood development for changing the trajectory that the littlest citizens. And I really want to, I guess, emphasize that framing that, they are citizens in the same way that adults are citizens. And I think as I've gone through and I've listened to the amazing speakers tonight, it's been phenomenal. I feel like I've learned a very great deal. I do think it's probably something we haven't quite captured sufficiently yet, is the power and the opportunity presented by those really critical early years, both sort of pre and postnatally. We've been saying this a while, Harris, and I'm delighted to be able to be here tonight to actually make that sort of comment in a broader audience. But I think what early childhood development offers, we know that in the construction of brain architecture, those first 1,000 days particularly are the prime time when we're laying down the foundations of the brain architecture that will determine a lot of the things that we've been talking about, particularly when we think about that emphasis on thriving as opposed to disease later in life. We're thinking about some of the things that were mentioned by the earlier speakers about understanding what those determinants to fight off and be resilient to later disease look like. I think we're going to find many of those answers in the work that we do in better understanding and better promoting positive early childhood development outcomes. So we've taken that lens into the work that we do at Minderoo. The community's focus area, our ultimate outcome is that, you know, we're seeking to see all children reaching their full potential. And I guess for us, a core component of that is recognising that they have to do that within the context of thriving communities. So I'm really delighted to back in Paola's comments about the really significant role that arts and culture play in that. For us, we're trying to do some very innovative research in Australia at the moment to understand how philanthropy is best placed to actually work at that intersection between early childhood development and arts and culture. That could look like programming. It could look, there's some great innovation happening here at the moment around arts in the early years as mechanisms for growing and fostering civic participation, for instance, being involved, having hope, having a sense of belonging and identity in who you are as a person and in the community that you live in, which we know are, you know, a part of those foundation architectural levels that are being laid down in brains, because they're all about relationships and interactions with which little kids have. I think one of the other things that I was really interested in the conversation was around the availability of quantitative versus qualitative data. I think, again, this presents the early years as a really significant moment where we could be collecting. I certainly know in Australia and you know, in many places around the world, we have very interesting data, quantitative data that tells very specific stories around what's happening in relation to children's brains, whether they be through school-based measurements or survey work that's happening outside the school system. The Australian Early Childhood Development Census, which is a national data census that's collected every 4 years, does include domains that allow us to understand what's happening in the, you know, cognitive development of small children, and you know, is a model that we could be looking into and, you know, making parallels. It's not longitudinal at this stage, but there are certainly thoughts about how we might be able to create a longitudinal data set out of that, which, you know, ultimately might give us a picture of how some of those things we're learning about little children in those early years carry out across their lives. One of the things that you know, was particularly interesting for me as a philanthropist, as a new philanthropist, I'll just caveat that I've only been doing this philanthropy business for 12 months, so I'm very much learning. But one of the things that we're trying to bring to the work is that notion of the full spectrum of capital and how we can actually utilise that more fully in the work that we're funding. So everything, you know, from traditional grants to interest-free loans, social impact investing opportunities, nationally and globally, and we, across the foundation, we have other focus areas in relation to gender equality and natural ecosystems, and the spectrum of capital that's much more about social impact investing is much more well developed in relation to gender equality and natural ecosystems. Communities is the place where we're always hunting to find those types of investments that we can make away from traditional granting, and I think that's something that we should be thinking about. And then I guess the final thing I wanted to talk about was the concept of living labs. It's not something that we've actually embraced per se as a philanthropy, but we have taken a very, very determined and deliberate place-based approach to the work that we're doing. And in doing that, what we're actually seeing is, almost by accident, the emergence of geographically bound living labs in similar sort of context, where we're being able to observe what it looks like to make deep investments into some of the places where we're working with the, you know, small children, the families that they live in and the communities that wrap around them. And I think over time, what we're going to see from those quasi-experiments is, because we can match them to other communities, they're not specifically segregated. We don't have trial communities and non-trial communities, but I think because we have the data available to actually find a non-intervention community, we're going to be able to see some very interesting differences between how we've gone in the place-based locations where we're doing the work and places where we haven't chosen to intervene. So lots of really interesting overlaps between the work that we're doing and the types of investments we're making compared to what's happening globally. Two things just in my final sort of reflections. I don't think we've talked enough about systemic inequalities globally and the responsibility I think we all have to play in understanding that it's not a level playing field. both in terms of early childhood development, but also some of the other things that we've been talking about. And then finally, my natural ecosystems colleagues would be quite distressed if I didn't emphasise that this is a changing game that's being impacted by climate. And the more conversations we have about particularly things like heat, humidity, and the impact on the brain, I think the richer our understanding of this is all going to be. But thank you for having me, Harris. I'm really delighted to be here.
Wonderful. Penny, brilliant intervention and reflections. I think people that are listening in can see of the dynamism of the Minderoo Foundation and the way that you are actioning things sort of across the spectrum from gender to early childhood to climate and integrating into place-based. And I do like place-based as a term here, because living labs are just one methodology, of course. So maybe place-based is what we should have named the webinar, as more agnostic, and we can think through which methodology ultimately makes the most sense for which region. So I appreciate that. And maybe to add a couple extra points about Minderoo, because you guys do so much, the work that you're leading on plastics and human health is also leading. Sarah Dunlop's work there, understanding that plastic pollution is not just in our environment, but it's in our bodies now. Plastics are breaking down into micro and nano, and that's getting into our brains. And so the work that you guys are doing there is very illuminating. It's trailblazing stuff, and we'll watch this space as the science matures and think about what to do about it. And the other thing is frontier technologies, which we should probably bring into the discussion as well. You guys have a big frontier technologies division, and of course the role of algorithms to either boost us as humans and better citizens and employees, or algorithms to addict us and cause us issues relevant to social media, mis and disinformation. So anyway, just to add those extra points about Minderoo so everyone has a full wide angle context. But you mentioned systemic inequalities. It's a great segue to our next discussant, which is Facundo Manes. Facundo has been on this journey with us since the beginning. Facundo is an actual sitting congressperson coming to us from Argentina. Facundo is not just a politician, but he's also a neurologist, neuroscientist, and psychiatrist. And so thank you, Facundo, for spending your precious time with us. We look forward to your reflections from Argentina, from the global south, and of course you travel the world. So how does this relate from global north and global south, sharing and comparing notes between different parts of the world? Over to you, Facundo.
Thanks, Harry. It's good to see many friends here, and congratulations for all the work that you are doing. It's really exciting. So, as Harry said, I am a neurologist, a neuroscientist, and also a congressman person. So my work life is divided in two. I am founding director of the INECO Foundation for Research in Neuroscience, in which we promote research in Latin America in neuroscience, and also we educate the society about neuroscience and brain health and brain conditions, and also we educate the colleagues, the doctors, the psychologists, the neuroscientists in Latin America and in the world. And then also I have another part of my work dedicated to public policy. So I will present a few slides. Let me check. Yeah, can you see that? Okay. So okay, let's go. In INECO, I am founding director of INECO Foundation for Research in Neuroscience. We do this kind of work that the McKinsey people are mentioning, about how neuroscience and mental health can help organizations and also cities. We are working with different organizations in Latin America to promote mental health, brain capital in their organizations, because many people, as you know, are under stress. They have insomnia, they cannot sleep, they have all kind of burden. And also we are working with some mayors of cities in Argentina from INECO. Actually, I am now in politics, so the INECO leaders are working with different cities in Argentina, trying to promote brain health among teachers, the member of the security forces, etc. But my real task in this stage of my life is bridging neuroscience and public policy. And sometimes, as you know, the neuroscience breakthrough, the news in dementia, depression, and addiction rarely influence public policy. Scientists and policymakers operate in different domains with distinct goals and communication styles. So we really need network like this that connect researchers and policymakers to translate findings into actionable strategies. So I think we need to foster these networks and ensure non-partisan inclusive collaboration for broader acceptance and success. So my vision for the future is, I think, share with all of you, is investing in network that can enhance evidence-informed policymaker in public health outcomes. And as Harry said, I belong to the neurological world, and I travel around the world, but I live in Argentina and I work here, and I want to change my country and my region as a politician. So I am very concerned about poverty, because in Latin America, in Africa, in many parts of Asia, poverty is a big issue. I think it's a big issue also in America and in Europe, unfortunately. Poverty produces a cognitive task because it depletes our mental resources. You can see here on the left an brain scan from Harvard, who show on the left the brain of a kid coming from a poor family with less connection than the kid from the right, who came from a family from upper middle class context. And in the bottom of the slide, you can see on the left the number of words that a 4-year-old from Ecuador, who came from a middle upper class family, can nominate, can describe. And on the right, you can see the number of words that a kid coming from a poor family in Ecuador can describe. So this is immoral, and you can see that brain equality began at birth. So we need to work on this. And there are studies around the world that can illuminate us how to move forward. In Jamaica, a few decades ago, social workers were visiting poor kids with social stimulation and proper nutrition. And an other group received only proper nutrition. And after 20 years, the kids who received from social worker 2 or 3 times a week, no big deal, and with elementary tools, very basic tools, but the kids were able to play with these basic tools and talk to the social worker. And 20 years later, the kids who receive cognitive and social stimulation 2 or 3 weeks per week, basic stimulation, have a higher IQ. They were better in math and language. They complete more years of schoolings, and they have lower level of depression, less involvement in criminal activities. So it is clear from neuroscience that investment in early childhood should be at the center of a country development strategy. So what needs to be done? Basically, find ways to bring this parenting program or this neuroscience research to a scale. And this is basically what we have been doing in Argentina in the last 20 years, since I came back from England and America, from my training in America and in England. So 10 years ago, we developed in Buenos Aires province, where half of the population in Argentina live, a mental capital unit with the governor of Buenos Aires at that time. So we developed a mental capital unit as a network with the government, the private sector, a sport institution, international agencies. The International Development Bank finance us to do this big scale cognitive and social and nutritional stimulation in kids, in poor kids. And we also involve schools and non-governmental sector. But now, since I am a congressman, we are working in a bipartisan bill called Integral Human Development and Mental Capital Promotion Law. And it's the first one in the world, I think. And this law promotes the use of neuroscientific evidence to stimulate cognitive and socio-emotional skills among different populations through life, especially early life and in older people in Argentina. And also, 10 years ago, we developed a national Alzheimer plan in Argentina, but because it was created in an agency, then the government changed and the plan, the national Alzheimer plan was stopped. So to create this as a long-term policy, we are now working in a national bill for brain health and Alzheimer's disease. It's a bipartisan, a non-partisan and a bipartisan bill. And I think that if we pass this law this year, which I am very optimistic, I think that this will be a long-term policy in Argentina. Because as I wrote in Lancet Neurology a few years ago, in Latin America and in low income and middle income countries, we have the same problems as developed countries in Alzheimer and brain health, but with many little resources, and we are not well prepared. And in fact, as George and many of you know, most of the people with dementia will live in low and middle income countries. So we have a big challenge there. So we are working in this bill. We are working in two bills, the Human Developmental Capital Promotion Law and the Alzheimer and Brain Health Bill. And I think both of them will be passed this year, hopefully. So the final remarks is that initiatives from middle and low income countries can serve sometimes as inspiration for wealthy countries. Such as we learn from wealthy countries in many things. You can learn from what is happening in Africa, in Latin America, and in other poor regions. And also, I want to make another final remark, which is that people should look for the advice of experts, but we as experts should listen to the general public. So we need to work more in the relationship between experts and the general public in brain health and brain stimulation in childhood. Thank you so much.
Wonderful. Well, Facundo, thank you. You are really the #1 public official politician in the world in this area. In thinking about it, you understand, you've trained and lived in England and America, you understand that context and also the global South. So you've just taken us on a tour de force about how you got to where you are in politics, but then also innovative governance structures at a local level. And then, of course, with legislation, innovative governance structures and public policy at a national level. So We are very grateful that you're with us on this journey and educating us. And we look forward throughout the rest of this year and into next year, engaging with you and learning from you more in the context of the G20 and such. So again, thank you. And everyone can see that we have much to learn from you because you just really scratched the surface there. And so then in the interest of time, I want to quickly go to George Bradenberg because he needs to hop off at the top of the hour. George, you introduced yourself briefly before. So what further reflections do you have based on what you've heard so far?
There's a lot of intersection of interests and observations and insights from everyone on this phone. Thank you, Harris. Your unique skill in bringing together the action-oriented people around the world is somewhat unique itself. I will just mention the Davos Alzheimer's Collaborative's work in Africa. As a result of the enthusiasm generated by a conference we did in Nairobi in September, we are planning a continent-wide effort in Africa over the next 5 years with 6 priorities. But the key themes here are a life course perspective, which does bring up what Minderoo is doing and what Facundo just noticed. So there is some obvious linkage there. Welcome Leap has been supporting 1KD First 1,000 Days effort, as has the Gates Foundation. And second, because of the diversity of Africa, it is uniquely suited to provide a very interesting example of what Facundo just said was the ability of the Global South to teach the Global North a lot about the diversity of these different brain disorders and about the different contexts in which we can tackle brain resilience. There are multi-generational capacities in Africa that don't exist in most continents. There are multi-generational families in Africa which permit you to collect data in a systematic and common data protocol fashion, and potentially with a continent-wide data platform. Think UK Biobank at a continent level. Think about putting AI and machine learning on top of a common data set across all of Africa to understand the differential impacts of climate, the differential impacts of social context, the different impacts of genetics and biomarkers of aging and of other diseases, and the social markers of resilience. Africa offers an extraordinary opportunity for us to pull a lot of the thoughts that have come out on this phone call together in a way that tries in a living lab fashion, but at a continent-wide scale, to actually try to implement something that really can teach us a lot about brain resilience, the social and environmental and exposome factors associated with all of that, as well as the disease conditions that were very widely by different genetic types and different environmental contexts. So that's what we're focusing on as our living lab right now, although we do have projects going on in Latin America and Asia as well. And we're working in Europe in the high resource countries simply because right now that's where the new disease modifying agents for Alzheimer's are present, and the health systems in the high resource countries are no more well developed than Africa. They are sticky and they're not well designed for dealing with brain disorders. So I thank you for crowding me in. I apologize to Cara, who will be given very little time, but nevertheless, I appreciate being invited, and I appreciate all of you who have given me such insights and ways to connect with you on what we are doing.
Brilliant, brilliant. Well, thanks so much, George, for being here, and glad we could sneak in your final reflections before the end. And we'll follow up, George, and with what we're doing on the G7 and World Health Assembly and UN and G20, and all roads will ultimately be leading back to you, George, and your organizations. And then in the interest of time, Cara Ultimus also has to jump in a couple of minutes. But Cara, thank you for being here from the Milken Institute. What would you like to impart upon us as a high-level philanthropy strategist? You think about these things all the time.
I'll try to keep it to 1 minute. I want to double click on a comment that Shiva made around how innovation in practice requires innovation in finance, and connect that back to something that Kana teed up for us at the very beginning in one of her slides, where she was highlighting that we typically fund in a value chain agnostic manner, and we need to instead shift gears and fund in a more specific, innovative manner. And if we bring those two ideas together, what we see is that philanthropy is able to play a role in navigating through and providing very specific kinds of funding, very specific shapes of funding for a problem at hand. So in the last couple of seconds, to just say we've piloted a new initiative called BD Squared, which is Breakthrough Discoveries for Thriving with Bipolar Disorder, that speaks to a very specific severe mental illness. But in that space, we've used philanthropy to break down the false dilemma that we have to focus on either expanding basic research or improving care today. And we've created a system where both of those things are happening across a range of institutions in a really innovative manner that learns from care and is infusing research into care. So I'll pause there, and thank you, Harris, and everyone for elevating the topics today.
Brilliant. Thank you, Kara, for your insights. And of course, BD Squared is a wonderful example of actioning this, and you're really changing the face of bipolar disorder with that project. Now that we've had all of our keynote interventions, all of our discussions, and we're at time. We're 1 minute past. So thank you all for being here and for your engagement, and folks for listening in. We've covered the waterfront from, pre-birth, first 1,000 days, through to Alzheimer's disease and its prevention. We've also explored different contexts of the global South and the global North. And we're also thinking about the different types of place-based engagements, whether it's in a business or in a regional context or a national context, or I guess continental. We've talked about that in some ways today. Please just bear with us as we go from this, as we say, hope to action. You'll hear from us in the coming weeks as we get much more granular on actually launching some place-based initiatives, things that can boost productivity, GDP, well-being, social cohesion as well. So anyway, that's all from us this morning or this evening, wherever you are in the world. Thank you again, and you'll hear from us soon.